Hi, my name is Duncan Bakken and I'm a senior lecturer in the Institute of Clinical Exercise and Health Science. A strength of the university, and indeed the Institute of Clinical Exercise and Health Science, is our established links with the local community, and in particular local primary schools, local secondary schools, education authorities and healthcare providers. For instance, we have previously devised and evaluated a number of school-based health interventions within South Lanarkshire that have been embedded within the school curriculum. Undertaking interventions such as these is always a challenge, but the relationships that we've built up over the years with the local high schools, with the local teachers, has allowed us to work collectively in implementing health-enhancing school-based initiatives. Currently, we're involved in research evaluating a school-based health initiative devised by NHS Lanarkshire. Through this evaluation work, we hope to evaluate the initiative, but also perhaps provide some feedback on how best to enhance and improve children's knowledge of physical activity and healthy behaviours.
Levels of nitrite and the levels of nitrate in the blood, and we've got two separate reagents that will react with those two metabolites in the chamber and will both produce nitric oxide, and then there'll be a reaction in the chamber here. This device here, the nitric oxide analyzer, will figure out or show how much nitric oxide is in the sample, and then it will convert it back to nitrate or nitrite, whichever one we're looking for.
So generally, my area of research is looking at the influence of ageing and exercise training on the heart and the cardiovascular system as a whole. So we're interested in looking at how ageing affects the structure and the function of the healthy heart, and then how exercise can attenuate some of the declines that you commonly see with ageing. So typically, as you get older, the function of the heart progressively deteriorates as you get older. And obviously in younger people, we know the benefits of exercise training on the function of the heart. So hopefully we can produce some interesting data to look at whether exercise in older individuals can attenuate and prevent some of that decline happening at later stages of life.
Our research team is particularly interested in how we can use exercise to modify some of the deleterious effects of ageing. So we're interested in how we can work with older people, and for us older people is anyone from the age of 60 upwards, and how we can use exercise and physical activity to improve their functional capacity, so they're at a lower risk of falls or loss of independence as they age. We've also got a research interest in some clinical populations. So we work quite closely with some of the rehabilitation units in the NHS, working particularly in multiple sclerosis, and how we can use exercise to improve the outcomes and the treatment of people with MS.
In my PhD, I'm looking at the effects of vascular function in older adults and how exercise has an effect on their vascular function to see if exercise can improve vascular health. As you age, vascular function becomes progressively worse, just independently of age. So that can be due to a number of different factors, including stiffening of the arteries. So as you age, they become impaired. So to measure vascular function, I'm using a specific method called flow-mediated dilation, or FMD. And with this method, we use an ultrasound machine to analyse the diameter and the blood flow of the artery, specifically the brachial artery, which we're using in my studies. And with that, we can see the dilation of your blood vessel after an acute period of occlusion.
I'm Dr. Lila MacLean, lecturer in sport development at UWS. We've been commissioned to conduct some research into the impact of walking football. This is an exciting new project because it's able to bring together the three programmes that we have in sport. So we have representatives from the programme of Sport and Exercise Science in Dr. Mark Sanderson and Dr. Duncan Bakken. We have representatives from the programme of Sports Coaching in Dr. Darryl Cowan and also Dr. Rosie Arthur, who are also experts in sports psychology. And then finally we have a representative from Sport Development, and that is me, as I have conducted quite a lot of research in community sport development and also exercise for older adults.
Hi, my name's Dr. Mark Sanderson. I completed my PhD in exercise physiology in 2014, and that investigated the acute neuromuscular effects of whole body vibration on performance. And certainly my main area of research is looking at using whole body vibration to enhance performance as well as rehabilitation. My other area of expertise and interest is in exercise and neuromuscular physiology, as well as sports performance and rehabilitation, as I'm also a chartered physiotherapist. With that area of research, I've looked into exercise prescription in stroke rehab, and I've published in the Cochrane database of systematic reviews and stroke journal. I'm also interested in clinical populations, and we have a successfully funded collaboration with the NHS and Lanarkshire councils looking at falls prevention processes and also interventions using a new piece of equipment. I'm also interested in wearable fitness technologies, for example these common wearable wrist-mounted heart rate monitors, looking at the variability, reliability and validity of these.